from CBS 2.
Good afternoon. Happy Easter. I'm Jim Williams. We're interrupting programming because Illinois Governor J.B. Pritzker is about to give his daily coronavirus update.
Good afternoon, everyone, and thank you very much for joining us for today's public update. And to those of you who are celebrating today, I wish you a very, very happy Easter, you and your families. April hosts many important celebrations for some of the world's biggest religions. I know how hard it is to break from traditional celebrations of togetherness, but I believe passionately that adapting our expressions of faith in these times is one of the most faithful acts of all. To hold our beliefs steadfast even as we defend ourselves against unprecedented challenges. So let me express my gratitude once again to all of you who are adhering to our stay-at-home order and washing your hands frequently and wearing masks when you go outside. You are saving other people from being sick or having to be hospitalized, and they, by wearing their masks, are saving you. Today's conversation will be a modified version of our normal update. The virus doesn't take a day off, and it's important for all of you to have the facts. So I'll continue to deliver them even though it's Easter. But in light of the holiday, I will keep this update brief. To start with, I want to thank Tim Cook and Apple. His team and he delivered 100,000 N95 masks this weekend to support our healthcare workers and our first responders here in Illinois. We are very grateful for their generosity and the generosity of so many companies near and far for stepping up to support their fellow Americans and especially supporting our heroes here in our state. I want to remind all of you who are at home, today is a great day to go online and take just 10 minutes to fill out your census form at 2020census.gov. Simple questions, it maintains your privacy, and it's quick. The more of you who fill out your census form online, the more money comes to Illinois from the federal government to support you, and the more representation we get in Washington, D.C. Also, since I want Illinois to be the best, frankly, at everything, I'll remind you that we are competing with other states to have the highest response rate in the nation, and we want you to fill out the form so that we can have the highest response rate to the census. And right now we're running 8th out of 50 states, 8th. So please go online and help us win this race. And now for today's medical report. As of today, we had more than 1,672 new cases. Sorry, just to be clear, we had 1,672 new cases for a total of 20,852, which includes many individuals who have already recovered. We now have known cases in 86 of our 102 counties. And I am deeply saddened to report to all of you that 43 lives lost in the last 24 hours, for a total of 720 fatalities in Illinois since the beginning of this pandemic. May their memories be for a blessing. I do want to point out on this Easter Sunday something of a blessing in the numbers that I've reported today. First, the number of tests completed for today has reached its highest number ever at 7,956 for the last 24 hours. That's almost halfway between the 6,000 that we've been averaging lately and the 10,000 that I have set for our next goal. That is great news on the testing front. I've spoken before about a stabilizing or a bending of the curve, and today is one more piece of evidence that it may indeed be happening. The percent of those tested that came up positive is almost exactly the same as it has been for the last 2 weeks. And the death toll today is lower than it has been in 6 days. I pray as we move forward that these trends continue, and if they do, it will be because of all of you adhering to our stay-at-home order. Doctors and experts confirm the fact that Illinois, having been the second state to announce a stay-at-home order, now seems to be reaching a peaking term, and our hopes have been coming to fruition. But they also say that we need to stay the course to make sure that we're keeping the progress going that we've already made. So to all of you on this Easter, stay healthy and stay home. Please be safe, everyone. Happy Easter to you. Dr. Ezike and I will be back here on Monday with some additional guests and some major updates. I want to thank you again for tuning in today, and I'd be happy to take any questions from members of the media. We have some in the room and maybe some online.
Hi, Governor.
Sir.
Will Jones from ABC 7 here in Chicago. My first question, could you put into perspective the new numbers today compared to yesterday, and where are we in this fight in terms of how close are we to this peak? Are we on a downward tide, or we're going up still?
You know, as you know, you don't really know until you start going down, you know, whether you've peaked. And what I look for is a leveling. Because the numbers had been going up exponentially, and then they were going up arithmetically. And you'll see this number today is higher than other numbers. It may be our highest number yet, but we also tested more than ever before, and that's how you end up with a higher number. You know, if we tested everybody, you would see the number spike significantly. So, so I'm pleased, though, because the percentage of those who were tested is about the same as in previous days, and it tells us that there isn't a larger percentage of people that are catching COVID-19, and it gives us a sense when you look at the hospitalization. We'll talk about this later in the week, but hospitalizations, ICU beds, ventilators, and deaths, which is a number that we do report every day, you'll see a kind of a leveling over the last 6 days. Indeed, this is a lower number than all of those days. So I'm, you know, optimistic, I guess, or I'm at least cautiously optimistic is a better way to say that we'll see numbers like this going forward, again, bouncing around, but not going up and up the way we saw them before.
2 more questions. Have you started to think about with your team, what is it going to look like when the state is going to open back up?
Yes, you know, frankly, weeks ago, I began conversations with people to understand how would we do that. It's a question of how and when. Now, the when will be, frankly, determined by when that curve starts to turn down and we see significant drop-off in these numbers. And then we have to ask the question, okay, well, after that happens, you still will only have had a certain percentage, a relatively low percentage, in my opinion, maybe less than 20% of the public will have been exposed to COVID-19, will have had it and recovered from it. So you wouldn't have herd immunity at that point. So the question is, how do you operate society when we've begun to bring down the level of infection and make sure that people are able to begin to go back to work in various industries? So I'm talking to industry leaders about that. I'm talking to economists about that. I'm also, very importantly, listening to the scientists and the doctors to make sure that we do this right, because what we don't want, the last thing we want, is to begin to open things up and then have a big spike in infections and, you know, unfortunately, all the spikes that come with that, including a spike in deaths. So we want to make sure we're not doing that while we're also looking at how we can get people back to work.
And my final question, this is somewhat of a personal question. This is a time of reflection for many. What has this crisis taught you about yourself and your leadership style?
Well, I mean, it's taught me a few things. I'm not sure it's so much about me, but I have terrific people who work for our government that I've brought on in the governor's office and in the agencies, across the agencies, and I'm very, very proud of them. I have a philosophy about who you want around you in, you know, when you're running anything. And it's a philosophy that says that, you know, you want people who are carry with them the values of honesty, integrity, loyalty, and respect. And if you have people around you who can't fulfill those, they're not worthy of being in your team. Now, most importantly, you want A players. who also meet all those criteria. And so, when I did that, when I came into government and I hired people that met all of those criteria, there were people who criticized me because I didn't hire enough of the kind of the political types, the usual folks who come in and out of government when the parties change hands. And instead, I was just looking for very high quality people who could do the job extremely well. And I think now, in this moment, when we have this enormous crisis upon us, and there's so many things that we need to do to serve people across the state, now is when you begin to see the quality that we have across our government. And so I'm proud of that. I'm not sure that's something I learned about myself, but I wanted everybody to know that whatever work I'm doing that is helpful to the people of Illinois is really because we have terrific people in government doing the job. So thank you for the question, Will.
This question is from Marianne at NBC. The Chicago Board of Elections sent out a letter today warning some people who voted at a local precinct that they might have come into contact with someone who had COVID. Was holding the primary during this crisis a good idea?
Well, let me begin by making sure everybody understands that the governor of Illinois, whoever that may be, and now it's me, does not have the constitutional power to shut down an election. So that's number one. Number two, we relied upon the local election authorities and then backed them up in this effort that they would have hand sanitizer, PPE, and all the things that would protect the people who are working in those facilities where people are voting. If there were electronic screens that people were touching, that those were being wiped down. And lastly, as you know, for the several weeks before the election, we were promoting heavily voting by mail. We thought that was a much better way for people to vote, to make sure that they weren't getting together, or to vote early. There are many fewer people who vote on each day of the 45 days of early voting before Election Day that allow people to go in and do it in a way where they're not around a lot of other people. As far as I'm concerned, when we look at the general election, we ought to be looking at allowing everybody in the state to vote by mail and making it easier for people to do that so that we have fewer people that would want to show up on Election Day at a particular precinct.
John O'Connor at the AP asks, you and Dr. Ezike routinely walk in wearing masks, then take them off to speak, the optimal time to project droplets on the lectern or others. Why wouldn't people think the message is wear a mask until you speak to someone?
Well, I'd say, first of all, we're very careful. When I come down to this room, I'm wearing a mask the entire time. When I leave my home and come to work, I wear a mask the entire time in the event that I would come in contact with others. And when we get to the lectern, I think it's important for people to see my face and for me to be able to project properly. We all know this is a single lectern. We're all touching it in various ways. You would see that none of us are touching our faces with our hands, during the time that we're speaking, and that we wipe down, you may not see this, but we wipe down this lectern and this microphone before everybody gets here and after we all leave. So we're doing it, I think, in the safest possible way, given all the circumstances.
Shia from Politico asks, the New York Times has documented now that early warnings of COVID-19 were ignored by the White House. States are having to pick up the slack now, but what should Congress do to make sure that doesn't happen again?
Well, I'm not sure Congress can do what the President of the United States can do. Remember, the President has intelligence agencies at his, within his administration. He also, and they predicted this and gave this information to the President. It's now been revealed months ago and months before the rest of us knew, and has the CDC under the federal government. So I'm not sure that that the President, that it's really on the Congress. I do think that overall the United States was not wholly prepared for this pandemic. Had the President heeded the early warnings that he was given, he could have begun to prepare the nation for this by invoking the Defense Production Act, by making sure that we had the national stockpile of goods that we need, PPE and ventilators. So I'm disappointed in the way that the federal government acted acted. I hope that we all would have learned the lesson that more needs to be done on the national level to prepare, and certainly all of us are now going to be readily aware that if the national government falls down again in a pandemic, that we're going to have to make sure that the states have to pick up the slack. I don't think that that's the way that the Federal Emergency Management Agency was intended to operate, or that the federal government was intended to operate, but at least under this president, that is how it's operating, unfortunately. So we'll do what we can to prepare for the next one.
Dave Dahl with WTAX. With all the attention paid to coronavirus, what has not gotten done over the last several weeks?
Well, I mean, there is so much that we had intended to do, and I could not possibly list everything. I will tell you this, that I have a whiteboard that I keep in my office. I had made a list of all of the things that I thought we needed to accomplish, big things this spring and this year, including on the administrative level, improving our ERP systems across the state, making sure that we're upgrading the workings of government, and legislatively, the important things that we all were talking about in January leading up to a legislative session. So I think it's clear that many of those things are not going to be able to get done this year. We're going to try very hard to, but as you know, between the challenges of the budget and the challenges of trying to overcome something that is truly life-threatening to everybody in the state of Illinois, it is likely that many things will have to be put off until next year.
Hannah Meisel with the Daily Line. Where are the drive-through testing facilities for which the state has extended its agreement with the federal government? When will the agreements end? How much slower are test results from those locations versus testing sites using state labs?
Yep. The state labs are 1 to 2 day turnaround of results. In an extreme situation, 3 days. But the federal sites have been running anywhere between 7 and now I've heard 12 days to get a result. So those three, the federal sites that were set up, the drive-through sites, are located mostly in the collar counties. I can get you the exact addresses of each one of those, but suffice to say that they're not located in the city of Chicago, and they're instead outside. We've got one, I think, in southern Illinois, but we need many more testing facilities. We need many more tests to be done. There's a lot of work to be done, between now and when we get where we need to be as we're trying to reopen things in our economy. And then lastly, we need to make sure that the turnaround time on those tests is much, much faster than it's not the federal government doing those tests. They're sending it to private commercial labs, which are just overrun. We have 320 some million people in the United States, and we obviously can't test everybody. There's only been less than 2 million tests done total in the entire country at this point. And here in Illinois, as you may see on the the numbers that we're presenting, we exceeded 100,000 as of today.
The number of COVID-related deaths at U.S. nursing homes has now surpassed 2,600. Is the state planning any specific measures to stop the spread at Illinois long-term care facilities? That's from Jim Haggerty at Rock River Times.
Yep, Jim, we've been working hard across the state from the very, very beginning to not only set standards for our own long-term care facilities that the state runs, including our veterans homes, but also for the privately run nursing homes, to set protocols for them, make sure they've got the proper amount of PPE, and that they're following the kind of the rule book that we set up for them. It is very difficult in these congregate settings for there not to be some spread that's occurred. But I want you to know that very early on, I don't know the exact date, but about middle of March, we, indeed, I think earlier than that, we shut down having visitors come into these facilities. We made sure that we were checking people on a medical basis who work at the facilities every day before their shift, and doing everything that we could to keep the virus from getting into a facility. And then if it showed up in a facility, first of all, getting the right medical attention for people if they should need it, outside medical attention. And then if anybody has it inside a facility, to separate them from people who don't have it. So that's been going on for some time now. What are we in? Almost the middle of April, and that was about the middle of March, which was, very shortly after we all became, acutely aware of what we needed to do as a state.
This is from Rich Miller at Capital Facts. What is your opinion of the new rules issued by the U.S. Department of Labor for 1099 workers?
You're talking about the unemployment insurance for them. Look, I wish that they had a system that would allow each of the states to immediately stand up an unemployment benefit process for independent contractors, but they didn't do that. And so each state is now, struggling to put something up that will work for those independent contractors. We're doing the same while simultaneously dealing with the hundreds of thousands of new unemployment claims coming in under the regular system, which was not built for what it is today, where, we're doing multiples and multiples of unemployment applications than we ever have done before. Even now, as we've built up the system and it's doing much better. I wish the federal government had given us a system that we all could use in common, but that didn't happen.
This is from Greg Bishop at the Center Square. What steps are you taking to plot out allowing non-essential businesses to reopen?
That's akin to a question I got earlier, and I'll just say that I've been talking to business leaders, industry leaders, association leaders to try to figure out, for example, in various manufacturing businesses, how do you get your manufacturing process to a point where people can be socially distant from one another when maybe they weren't doing that before? And I think that's going to be industry by industry, maybe even company by company, something that needs to be worked on. So this is going to be a little bit complex. Can't just open everything up and say, do what you like, because we'll have a big infection rate hike in the state, and we want to make sure that we're doing the best we can. We're making real progress. I think this is a moment when everybody should be hopeful that that progress is going to lead to a downturn in the number of new infections per day, which leads to a bunch of other very positive outcomes.
We'll do one more question in the room, and that'll be the last one.
Will?
I have a question from a reporter at WGN. He wants to follow up on the election question about how are you going to be able to ramp up mail-in voting to a level that everyone in the state could participate if they wanted to?
Well, we have the ability to do it. Remember that everybody has the right now to make an application. I think many people don't know that. And I think we should make it even easier. Many other states have just made it mandatory that every voter gets an application to get a mail-in ballot. And so that's one way to do it. Another way to do it certainly would be to make it better known, to have PSAs, for example, to encourage people not to go in person and instead to use a mail ballot. But other states have done this. We would not be the first, and we could follow the lead of those states in order to get a situation where we're keeping people safe when they want to go vote, but shouldn't be leaving their home.
All right. Thank you, everyone.
Yep. Thank you. Happy Easter, everybody.
Governor Pritzker's daily afternoon COVID-19 briefing, 1,672 new COVID-19 cases altogether in Illinois, more than 20,000 cases. 43 additional deaths, 720 deaths in Illinois altogether. The death toll today, the governor said, is lower than it's been in 6 days. 7,956 people have been tested in the last 24 hours. And another bit of news here, the Apple company is shipping 100,000 N95 masks to Illinois. Join us for the latest updates on our news at 5:30 and on CBSChicago.com. I'm Jim Williams. Happy Easter.
This has been breaking news from CBS 2.